Parenting adolescents or teens can be difficult for any family. Families of teens and kids with neurodivergent issues such as ADHD, autism, learning difficulties, or other neurological variations, these years are especially challenging. And after working with families of neurodivergent teens for over 20 years, I've seen some ways and some struggles, unnecessary struggles that families have gone through. So today, I'm going to go over 3 common pitfalls to look out for, and in understanding them, it's going to transform the relationship you have with your teen. So let's get into it. The most devastating mistake that I see in my practice is having what's called the expectation gap. That's the painful space between neurotypical expectation and neurodivergent reality. And this gap manifests itself in 3 different ways that can harm both the teen and the parent and the relationship with one another. Number 1 is fixing the behavior instead of trying to understand it. Many parents fall into this cycle of trying to normalize their teen's behavior versus trying to understand where their neurodivergence is coming from and how that manifests itself and different ways to approach this. There's more research that's coming out that shows that parents who try to fix this behavior show very poor outcomes, poor relationships with their teens versus parents who take a more acceptance-based approach. So let me give you an example. I worked with a parent one time to where they would get extremely frustrated that their teen wasn't cleaning their room. And I understand why. This was an issue that had been going on not for a week or two, but for years. They've always been asking them, like, clean up your room. Is your room cleaned? I've asked you to make your bed. Is it made yet? And it just wasn't getting done. So what the parent was doing was yelling at their teen, getting extremely frustrated with them, and then sometimes feeling bad. That's how they reacted, and then feeling guilty about it, and then cleaning up the room for them. And then they felt guilty about that. So do you kind of see the cycle that's going on here? They regretted their own behavior, and then the cycle would start again. The yelling, the frustration. This isn't changing. What's wrong? And then on top of that, do you think the teen was learning how to clean their room? Do you think the teen was following through on that? Now and again, yes, but for the most part, no. After their parent cleaned up their room, guess what happened? You'd be right. It was a giant mess again. And again, the whole cycle just happens again. So what did we do instead? Here's a strategy that I used. I brought them in. It was a teenage boy and his mother. And what I had him do is bring in his backpack. And his backpack was a giant mess. This kid had ADHD, had organizational difficulties. That's why cleaning up the room, following instructions, organizing things, that was more difficult for him. So in this intervention, when I had him bring in his backpack, I had the mom there too. I had set it up beforehand and went over the rules. The mom isn't to do it for him. She's there as a guide. She's there to help him when he asks for it. And so we all sat in the room, and one paper at a time, one folder at a time, one assignment at a time, he cleaned out his bag. She was there to help him organize, to help him look at what things he needed for school and what things he could throw away, because there was a lot of trash in there, various objects in there that didn't need to be in there, books that weren't there for school. She helped him organize that, and they did it together. They did it collaboratively, and the outcome of that was much better. She had to help him a couple more times, but shortly thereafter, he was able to do it on his own. It was a skill that he had to learn. And by accepting that he had some neurodivergence and wasn't quite getting these instructions when you're just telling him this, you had to show him, you had to guide him, you had to be accepting of him. Then the change was able to happen. One, the mother realized he wasn't trying to get out of it because he was lazy. He had neurodivergent issues. He had ADHD. There's nothing wrong with that. Two, the patient was better able to organize at that point. And it wasn't just the backpack that he was better able to organize. His room started getting cleaner. He was turning in assignments more. And three, their relationship improved. And when his room was a mess again, and like any teenager, of course, it's going to be a mess again, instead of yelling at him and getting frustrated and starting that whole cycle over again, she came at it with an acceptance-based approach. She came in there and they collaboratively worked together to clean up his room. The second pitfall that I see is mistaking developmental differences for defiance. Often neurodivergent teens have a different timeline of their development than neurotypical teens. And this can be often misconstrued as willful defiance or they're lazy. And when it's viewed through this lens, it can often create this cycle of shame and punishment that makes the teen feel guilty or shameful of their behaviors. And then it's really going to hurt their self-concept, not just as a teen, but becoming an adult. It's going to stick with them and essentially scar them for the rest of their lives. There's been some really good research by Deci and Ryan, 2020, and all the research that I reference, I'll put down below. And their research on self-determination theory, which focuses on supporting autonomy for your teen versus control. And this has been shown to lead to far better outcomes. Is that when parents are able to differentiate between neurological differences versus normal teen boundary testing, teens tend to develop stronger executive functioning skills and emotional resilience. And this is because their parents are able to see them far more accurately on what's going on. Let's consider emotional regulation. So a neurotypical teen might recover from something very frustrating within a couple of minutes, versus a neurodivergent teen, it might take them a much longer time because they're processing these things differently. So essentially, their nervous system is functioning differently. And when you punish this, it's not teaching them emotional regulation. Rather, it's making them feel shame for how their brain naturally works. The third pitfall that I run across is neglecting to prepare for the real world appropriately. One of the more difficult conversations that I'll have with parents is when parents tell me, look, I understand what they're going through. I know this is hard for them, but the real world is not going to be able to accommodate them. So they need to learn how to cope with this issue now. And I recognize that even though this perspective is very well intentioned, you want to teach your teen how to cope with the world because you're right, the real world is difficult. And even though this perspective is very well intentioned, you're trying to help them learn, you're trying to help them cope. But there's a really big misconception within it. The world won't be accommodating to them. But that's not true. More and more people are understanding and learning more about autism, and the world can be more accommodating. And there's more research that's coming out to where if we can change the environment and change different things that are happening to accommodate their sensory needs, it can have far better outcomes versus just telling them, it's your problem. You're the one that needs to cope. No. The world can adapt. And there's research that's coming out, Wong et al. 2023, and again, I'll put a link down below, that if folks are able to get accommodations, there's far better outcomes for them. And not just accommodations, but also taught self-advocacy skills. And when folks have both of this, accommodations and self-advocacy, the research is showing that you have better job satisfaction, college completion rates, and overall well-being versus being told that it's your problem or that you have to mask all of these issues. The key isn't forcing teens to function in neurotypical ways. Rather, it's teaching them the skills to self-advocate and understand their own unique needs and skill sets. So moving beyond these pitfalls, building a bridge between this expectation gap requires a shift in perspective. Instead of focusing on what your teen should be doing by neurotypical standards, ask yourself, what sort of supports does my teen need in order to be successful? How do I help them function at their best? How can I help them understand their own unique needs? And what strengths come with their neurodiverse perspective? By recognizing that different neurological wiring requires different approaches rather than lowered expectations, you're going to be able to help your teen build the confidence that they need in order to self-advocate for themselves. Along with build confidence and self-understanding, that way they don't have to mask. So what I'm talking about is this doesn't mean abandoning guidance or boundaries that you had set out for your teen. Rather, this creates a framework that supports your teen's true developmental needs and teaches them the self-advocacy skills that really will prepare them for adulthood. And remember, your neurodivergent teen is not giving you a hard time. They're having a hard time in a world that isn't designed for them. And in closing the expectation gap, you're going to become their closest ally in navigating that world. If you enjoyed this video, please stick around. I have another video. It's a 2-part series on teens on the spectrum that have anxiety. So I'll put the first one right up here. Hopefully see you there. Take care. Goodbye.